Hi there, welcome. It's Jackie Cambridge. Welcome to one of our 5-minute videos, take 5 for health and safety. In this particular video, we're going to just have a look at psittacosis, which, as you can see, is spelled with a P and not an S. So psitticosis, also known as pigeon fancier's lung, bird fancier's lung. Okay, psitticosis. So psitticosis, it's caused by a bacteria. It's the Chlamydia psittacosis bacteria. And it's carried by birds in the parrot family. So parrots, parakeets, those budgerigars, those types of things. So originally it was called parrot fever. Now it can spread readily to other birds. So originally it was parrots, but now it's been spread to other birds which are actually out in nature, but also birds that are used for food like chickens and turkeys and things like that. So it's very easy to spread. So it causes a condition known as zoonosis, which means zoonosis is a generic term for conditions that can affect animals, but then can infect humans. So birds can carry this particular bacteria, but the bacteria can spread to humans and then cause ill health in humans. So who's at risk? So obviously workers in bird-related farms or situations, vets, people working in zoos, pet store owners, but even construction and maintenance workers coming into contact, because it's not just contact with the bird or the animal, it's actually contact with their feathers, their feces, their skin. So construction workers cleaning the outside of buildings, cleaning up buildings where we've got lots of bird guano and droppings, they could also be at risk from bird fancier's lung or pigeon fancier's lung or psitticosis. So the symptoms: you breathe in the particles of skin, feathers which contain or feces which contain the bacteria. So you breathe it in, you can get a dry cough and then sort of breathing problems. That can lead to a general fever, very hot and cold and shivery, headaches, joint pains, muscle pains and things like that. But then in the longer term, it leads to pneumoconiosis, and pneumoconiosis is like a scarring of the lungs. And when you've got scar tissue in your lungs, it means that you're not able to take in as much oxygen as you should, and you're not able to breathe out as much carbon dioxide as you need to. And then you get lethargy because you're not bringing in as much oxygen as your body needs for you to be healthy. So in terms of controlling the risks of psittacosis, if you've got workers who might be at risk, we need to use work methods that prevent the particles becoming airborne, because it's when you breathe them in that is the problem. So is it possible to damp down surfaces and things like that, where there are going to be the feathers and droppings in the air? So respiratory protective equipment, very good standards of personal hygiene, because even they can breathe it in, you don't want it on your clothes, on your hands and things like that. Again, having not only personal hygiene procedures, but welfare facilities, ability to change your clothes, to wash, to shower, these types of things. So good pest control in terms of perhaps you've got pigeon infestations and things, so trying to stop that from happening, and regular cleaning and disinfection of the work area, but doing it with methods that do not generate high degrees of dust. So thanks very much for watching. That's a quick potted tour, take 5 for psitticosis.